All right, folks, welcome back to the channel. And today we've got something that's going to blow your mind if you're in the healthcare or education industries. Today we're talking about ChatGPT and how it's being used to teach one of the most complex topics in nursing, septic shock in intensive care units. Now, if you're wondering how an AI like ChatGPT can help nursing students understand critical care, you're in for a treat. See, this study takes a deep dive into the potential of AI-driven learning, and let me tell you, it's pretty groundbreaking. So here's the deal. Nursing education is tough. You're dealing with life or death situations, complex medical concepts, and high-pressure environments. Now imagine trying to learn all of that while also navigating an overwhelming amount of information. So this study asked, can ChatGPT help? And the short answer is, yes, it can. But it's all about how you use it. You see, the researchers behind the study used ChatGPT to teach nursing students about septic shock. And now septic shock is no joke. It's a life-threatening condition where the body goes into shock due to an infection. It's something nurses in the ICU are dealing with every day, and it requires quick, smart decision-making. But here's the problem. Learning about septic shock is complicated. So the researchers thought, let's use ChatGPT to make learning this topic more interactive and personalized. And so here's how it worked. First, they tested different prompts. Prompting, of course, being the questions that you ask ChatGPT for it to spit out an answer. So the researchers found that the more specific the question they asked, the better the answer they got. So for example, asking something like, what are the treatments for septic shock? Got a good response. But asking something more like, what are the most common complications of septic shock in ICU patients and how should nurses manage them? Well, that kind of question got an even better response. And here's the kicker. It wasn't just about asking the AI a question. The researchers had to refine and adjust the prompts. And if you ask the AI a vague question, you're not going to get the most useful or specific information. So the study really focused on crafting the perfect input to get the best output. The second stage of the study involved applying these prompts in a real learning environment. They wanted to see how well nursing students could use ChatGPT to learn about septic shock, particularly in a critical care context. And guess what? That works pretty well too. The students were able to engage with the AI to get answers to complex questions about septic shock, which helped them practice their clinical decision-making skills. But here's the catch. This isn't a magic bullet. Just because ChatGPT gives you an answer doesn't mean it's always going to be 100% correct. These students had to verify the information. And this is where critical thinking comes in. ChatGPT can help, but it can't replace clinical judgment or evidence-based practice. The researchers in this study emphasized that while AI is a powerful tool, nurses and educators need to use it wisely. So what's the takeaway here? Well, the study proves that ChatGPT can be a game changer in nursing education, especially when it comes to complex topics like septic shock. It's like having an assistant that can answer your questions at any time, helping you understand difficult concepts. But the key is that you need to ask the right questions and verify the answers. ChatGPT isn't infallible. It's a tool, not a replacement for expertise. And here's where things get really interesting. This study opens the door for AI to revolutionize healthcare education. Imagine using tools like ChatGPT to stimulate critical care scenarios, help students practice their clinical reasoning, or even give them immediate feedback. This could transform how nurses are trained, helping them make better decisions in high-pressure situations. And this is important. Nursing schools have to get on board with this. We can't just throw AI at students without teaching them how to use it effectively. Educators need to equip students with the skills to use AI tools while also ensuring they have an understanding of the importance of evidence-based practice and critical thinking. So here's the bottom line. ChatGPT can help nursing students learn more effectively, but it's all about how it's used. It's a tool that can enhance the learning experience, but it's not a replacement for hands-on training or expert guidance or clinical judgment.